Hi. Okay, this is the second part of your PowerPoints for week 4, and this one talks about patient safety. And so we're going to continue on with this for just a few more slides. And the health record as a tool for patient safety. Now I know that you're in health records management, or that you have taken health records management, or you will take it sometime in the future. But what you learn in health records management is the health record as a tool for documenting patient care. But it's also a tool for patient safety. So quality of care is key to patient safety. And so they monitor that information in the health record, and they use that information to manage risk and improve care. So what it is a communication tool for all members of your healthcare team. So when everything is used, the clinic documentation, your lab reports, your x-ray reports, all your reports, that's when you get the best chance of receiving quality care. So information about that patient that's documented in that health record will provide that organization to use in re-educating their caregivers and help them improve their skills. And that's called peer review. But it's also due to assess performance. The health record is a legal record, which you will learn about in legal aspects of health information in your spring course. But it's a business record and a legal record. It's a business record for the organization, so because of that, information documented in that can be used in a court of law as evidence to substantiate the quality of care that was given to that patient. So they must always, as a healthcare professional, not only must it be completed according to standards, but it must be completed to the highest standard because it is a legal document. The governance of the health record. Okay, the governance of the health record. In other words, who tells you what has to be put in it? And I've mentioned this several times in the last few weeks. So the governance of the health record are governed by many different agencies. So they include your federal laws, your state laws, regulations that come from administrative agencies, and rules that come from administrative agencies. If you recall, the Joint Commission is voluntary accreditation. They also speak to what has to be in the documentation of that record. The one thing we haven't talked about is medical staff bylaws. And bylaws provide direction for the completeness and maintenance of documentation in a health record. So when we get to the unit on hospitals and the workforce, we'll mention this. But bylaws for the medical staff are actually written by the medical staff. They follow the standards that have to be done for documentation in that record. So your medical staff bylaws may say that a record has to be complete in 30 days. That could mirror the conditions of participation. But maybe your bylaws might say records have to be completed in 20 days, which is more stringent than accreditation. The bylaws basically direct the performance of the caregivers. It's very difficult to keep up with all the changes in record policies. So whatever policy a healthcare facility uses, they want to make sure that they're able to be compliant with it. Because if you can't follow your own policy, or if you make it so strict it can't be followed, you're setting yourself up to show a poor quality of care. The quality clinical documentation for legal purposes. Handwritten documentation is very difficult to read. For example, I remember one time when I was working in the field, we had a patient see a consultant for a condition, and they came back with a handwritten order for medication. And it took 4 people to decipher what was written on that note. Eventually, I was able to figure it out, and then we called and confirmed with the provider that it really was that med. And then the nurses confirmed it and went back to the doctor and they confirmed it. But that just shows you how poor quality handwriting could lead to a potential error. Another time when I was working, an error that happened, a patient had gone for treatment and they had high blood pressure medicine, HCTZ, hydrochlorothiazide. The nurse read it wrong and gave a different med, and it was over a week before they noticed that med was different. The reason it was she missed it because of the handwriting. So handwritten documentation has to be quality. So the guidelines say it has to be legible. Electronic documentation is a little bit different. One thing about electronic documentation, it's not handwritten, but if it's not entered correctly, it could still be an error. Garbage in, garbage out. So electronic documentation is easier reading, but you have to be careful of data entry. Quality clinical documentation to avoid fraud and abuse accusations. Clinical documentation improvement programs. These are called CDI programs. And you will learn about CDI in your coding courses. But clinical documentation, the focus is looking at the documentation in that record to make sure that the care that was given was following the guidelines, or what was documented represented the care that was delivered. So for example, you can't bill for acute respiratory failure if it's not indicated in the chart that a patient had acute respiratory failure. Maybe they just had difficulty breathing. So a clinical documentation improvement program will look at that to make sure that what was written in the record reflects the care given. And usually what happens is the documentation is insufficient. It needs to be improved to actually reflect the care that was given. Usually the documentation may not reflect the severity of that care. So clinical documentation is used for coding and reimbursement, which we'll talk about in week 12. And it also is used for issues of fraud and abuse. So compliance programs. This week you're going to do an assignment on compliance and compliance program tips from the Office of the Inspector General or the OIG. If you want a compliance program in your healthcare facility, you have to have written policies and procedures and standards of conduct for all your staff. You should have a designated compliance officer and a compliance committee. Why? One person cannot do it all. You need that committee, and you need the buy-in and the support from that committee to be successful. You have to provide training and education. You have to have a line of communication. You have to conduct internal monitoring and auditing. You have to enforce standards through disciplinary guidelines, such as if you do this, you will be disciplined. And some standards, you are instantly fired depending on what the violation is. And then if you get an offense, you have to respond promptly and undertake corrective action. You have to do an investigation and see what happened to that incident. We had a gentleman on our advisory board for the Health Information Technology Program, and his job was compliance. And what he shared with our group is that compliance is so involved, it's a full-time job. So it's a good career opportunity. Corporate integrity agreements. This might be a term that you may not have heard of, but they usually last 5 years. And under a corporate integrity agreement, basically what it says, this is what we're going to do to ensure that we have a compliance program. They last about 5 years. It tells you who they're going to hire. You write your policies and your procedures. You do comprehensive training. You assess that training to make sure your employees learn something. You establish a confidential disclosure program. So if I have a concern that something isn't quite right, I can report it confidentially without fear of retaliation. You can restrict employment of ineligible persons. You can report overpayments of reportable events, etc. But those are part of your integrity agreement. Compliance above fraud and abuse. We have the HIPAA privacy and security rules, which we talked about earlier. So for example, in compliance in HIPAA, what's your plan? What's your facility's plan for release of protected health information? Do you have a policy and procedure? How do you track release of information? to show that you're compliant with HIPAA privacy and you're not releasing information that you shouldn't. If there is a breach, who's going to be responsible to investigate that breach? What kind of training are you doing? Is there any kind of team that's reviewing your policy and procedures? All of these things have to be addressed in a healthcare organization. So this is a summary. So this week we talked about laws governing healthcare practice, and the laws that we covered were the ACA and HIPAA. We discussed the privacy and security rules, and we talked about clinical documentation and the importance of that, and we also talked about compliance programs. Now I just want to summarize. We're at the end of week 4. We haven't talked about hospitals. We haven't done any of this. The reason why I put this all up front is because in your other classes, you talk about documentation requirements. You talk about the impact of that. This is your baseline knowledge. So we're going to be getting into some different kind of things in week 5, but now you have a little bit of understanding. I also want to use your textbook, your Health Information Technology Applied Approach. You should all have one. Looks like this. That is your Bible for the program. This book has all of this information in it. Some information is in good depth, some is in little depth. But any of your readings here about HIPAA or whatever, it's in this textbook also for you as a resource. So use it. Terms you don't understand, look them up. But as a healthcare professional, you need to know these things. So put some time into reading your transcript for this week and checking your PowerPoints, and have fun with your assignments. We'll talk to you later. Thanks.